Hello and welcome to DocAT. In today's video, we're diving into the important topic of hypertension classification. According to American Heart Association and European Society of Cardiology / European Society of Hypertension guidelines. Don't forget to like, share, and subscribe for more amazing content. Let's break it down together. Hypertension classification and management, according to the American Heart Association and European Society of Cardiology. European Society of Hypertension guidelines. Hypertension stages. American Heart Association guidelines, 2017. Normal BP. Systolic. Less than 120 millimeters of mercury. Diastolic. Less than 80 millimeters of mercury. Keynotes. No hypertension diagnosis. Patients are encouraged to maintain a healthy lifestyle. Elevated BP. Systolic. 120 to 129 millimeters of mercury. Diastolic. Less than 80 millimeters of mercury. Clinical significance. Not hypertension, but a strong predictor of future hypertension. Lifestyle changes are crucial to prevent progression. Hypertension stage 1. Systolic. 130 to 139 millimeters of mercury. Diastolic. 80 to 89 millimeters of mercury. Key concepts. Lower threshold compared to European Society of Cardiology. European Society of Hypertension guidelines. Emphasis on early intervention. Management approach. Low cardiovascular risk. Lifestyle changes for 3 to 6 months before considering medication. High cardiovascular risk, e.g. diabetes, chronic kidney disease, history of cardiovascular events, initiate antihypertensive therapy. Hypertension stage 2. Systolic, greater than or equal to 140 millimeters of mercury. Diastolic, greater than or equal to 90 millimeters of mercury. Clinical features. Often requires medication for BP control. 2 drug combinations are frequently used. Hypertensive crisis. Systolic, greater than or equal to 180 millimeters of mercury. Diastolic, greater than or equal to 120 millimeters of mercury. Subcategories. Hypertensive emergency. Organ damage evident, e.g. acute renal failure, heart failure, stroke. Requires immediate hospitalization and IV medications. Hypertensive urgency. No acute organ damage. Adjust oral medications in an outpatient setting. Blood pressure classification. 2024 European Society of Cardiology. European Society of Hypertension guidelines. Non-elevated, optimal blood pressure. Systolic. Less than 120 millimeters of mercury. Diastolic. Less than 70 millimeters of mercury. Management. Emphasis on maintaining a healthy lifestyle with continued monitoring. This group is typically at low risk for cardiovascular events, but still benefits from preventive measures. Elevated blood pressure. Systolic. 120 to 139 millimeters of mercury. Diastolic. 70 to 89 millimeters of mercury. Management. Patients should be encouraged to make lifestyle changes, including dietary modifications such as the DASH diet, regular physical activity, weight management, and smoking cessation. Pharmacological therapy may be considered in high-risk individuals. Hypertension grade 1. Systolic. 140 to 159 millimeters of mercury. Diastolic. 90 to 99 millimeters of mercury. Management. Lifestyle modifications are the first step. Pharmacological treatment is recommended for most individuals, particularly those with high cardiovascular risk, e.g. diabetes, chronic kidney disease, or a history of cardiovascular events. First-line medications include ACE inhibitors, ARBs, calcium channel blockers, and diuretics. Treatment goals are individualized based on overall cardiovascular risk. Hypertension grade 2. Systolic. 160 to 179 millimeters of mercury. Diastolic. 100 to 109 millimeters of mercury. Management. Immediate pharmacological treatment is necessary for this group. Combination therapy may be required, often using 2 classes of drugs to effectively reduce BP. Hypertension grade 3. Systolic, greater than or equal to 180 millimeters of mercury. Diastolic, greater than or equal to 110 millimeters of mercury. Management. Aggressive treatment with antihypertensive medications is required. Regular monitoring to avoid complications like stroke, heart failure, or acute kidney injury. Isolated systolic hypertension. Systolic, greater than or equal to 140 millimeters of mercury. Diastolic, less than 90 millimeters of mercury. Management. More common in older adults due to age-related changes in arterial stiffness. Treatment focuses on lowering systolic BP with minimal effect on diastolic BP. Medications include calcium channel blockers and ACE inhibitors. Treatment recommendations. Lifestyle modifications, both guidelines. Lifestyle changes are universally emphasized and often sufficient for elevated BP or high normal BP. 1. Dietary approaches to stop hypertension - diet. Rich in fruits, vegetables, whole grains, and low-fat dairy. Low in saturated fats and cholesterol. Sodium restriction. Less than 2,300 milligrams per day. Ideally less than 1,500 milligrams per day. 2. Physical activity. At least 150 minutes of moderate intensity aerobic exercise per week. Strength training twice a week. 3. Weight loss. Aim for a BMI of 20 to 25 kilograms per square meter. Reducing 1 kilogram of weight can lower systolic BP by 1 mmHg. 4. Alcohol and smoking. Limit alcohol to less than or equal to 2 drinks/day for men and less than or equal to 1 drink/day for women. Complete smoking cessation. Pharmacological management. American Heart Association guidelines. Initiation thresholds. BP greater than or equal to 130/80 mmHg in high-risk patients. BP greater than or equal to 140/90 mmHg for low-risk patients. Drug classes. First line, ACE inhibitors, ARBs, calcium channel blockers, and thiazide diuretics. Combination therapy for stage 2 hypertension. European Society of Cardiology. European Society of Hypertension guidelines. Initiation thresholds. BP greater than or equal to 140/90 mmHg generally. BP greater than or equal to 130/80 mmHg for very high-risk patients. Drug classes. Similar first-line agents. Combination therapy preferred for grade 2 and 3 hypertension. Special considerations. 1. Resistant hypertension. Defined as BP remaining uncontrolled despite the use of 3 antihypertensive drugs, including a diuretic. Investigate secondary causes, e.g., renal artery stenosis, pheochromocytoma. 2. White coat hypertension. Elevated BP in clinical settings, but normal at home. Confirm using home blood pressure monitoring or ambulatory blood pressure monitoring before starting therapy. 3. Masked hypertension. Normal BP in clinics but elevated outside. Associated with increased cardiovascular risk, requires ambulatory blood pressure monitoring or home blood pressure monitoring for detection. 4. Hypertension in older adults. Lower targets for systolic BP may not be appropriate due to the risk of orthostatic hypotension. Goal: gradual reduction in systolic BP to 130 to 139 millimeters of mercury. Key differences between American Heart Association and European Society of Cardiology. European Society of Hypertension. 1. Stage 1 hypertension threshold. American Heart Association. 130/80 millimeters of mercury. European Society of Cardiology. 140/90 millimeters of mercury. 2. Emphasis. American Heart Association. Focuses on early treatment. European Society of Cardiology. Risk-based treatment. 3. Pharmacological initiation. American Heart Association. Starts at 130/80 millimeters of mercury if cardiovascular risk is 10% or higher. European Society of Cardiology. Initiates treatment for high-risk patients or with persistent elevated blood pressure. 4. Approach to elderly. Both recommend similar blood pressure targets for elderly, with European Society of Cardiology favoring more conservative treatment goals. American Heart Association Hypertension Classification, 2017. Normal. Systolic less than 120, diastolic less than 80. Elevated. Systolic between 120 and 129, with diastolic less than 80. Hypertension stage 1. Systolic between 130 and 139, or diastolic between 80 and 89. Hypertension stage 2. Systolic 140 or higher, or diastolic 90 or higher. Hypertensive crisis. Systolic over 180 and or diastolic over 120. European Society of Cardiology Hypertension Classification, 2024. Optimal. Systolic below 120 and diastolic below 70. Normal. Systolic between 120 and 129 and diastolic between 70 and 79. Elevated. Systolic between 130 and 139 and diastolic between 80 and 89. Hypertension grade 1. Systolic between 140 and 159, or diastolic between 90 and 99. Hypertension grade 2. Systolic between 160 and 179, or diastolic between 100 and 109. Hypertension grade 3. Systolic 180 or higher, or diastolic 110 or higher. Isolated systolic hypertension. Systolic 140 or higher, with diastolic less than 90. Thanks for watching Doc AT.